Welcome to the Deepak Saini Show.
He said he gon' huff and puff and blow my mind up. You meet the island girl, she might dirty wind up.
This is a special podcast episode taken from my summit that I ran last year, Reverse the Effects of Aging Summit. Do enjoy. Welcome back to the Reverse the Effects of Aging Summit. I am your host, Deepak Saini. I believe that a big part of healthy aging and reversing the effects of aging is understanding, how to keep our mitochondria healthy, proper sleep, and even some, latest cutting edge technologies. I'd like to introduce you to my guest today, Dr. Ross Carter. Dr. Carter is a leading expert in regenerative medicine, epigenetics, and longevity. With over 25 years of experience, he specializes in age reduction, cellular rejuvenation, and stem cell therapies. He's a sought-after speaker and authored 3 bestsellers, including Reprogramming Youth, The Revolutionary Method to Reawaken Your Health, Youthfulness, and Vitality. He's transformed countless lives. Ross, thank you for joining us here on Reverse the Effects of Aging Summit.
Well, thanks for having me. It's a pleasure to be here.
So I'd like to start with how did you get into this work? What got you to become a doctor in the first place, and then in the work you're doing now?
Wow, what got me to become a doctor in the first place? Well, that was a long time ago. Back in I graduated from college in 1996. So things have changed quite dramatically after 25 years. But it all boils down, I guess, to the same thing. Is I've always enjoyed helping people, and I want to do the most natural ways to help people as I possibly can, and I've been able to do that as I've evolved in my career and my focus. So I would say it's just the love and desire to help people.
Okay, very cool. And then how did you find yourself then into kind of where your work is right now, and how we first connected, sort of around stem cells and that sort of thing?
So back in 2011, I was playing intramural sports, like the recreational sports where you sign up for a league and
Sure.
You make friends and all that. That was my goal at the time, is to meet new people. And I started playing a sport I probably shouldn't play at 42, but I started playing dodgeball.
Okay.
And
Okay. Yeah.
yeah, you can see the problem there. It's really difficult to make friends, especially the female ones. And because, when you hit somebody in the face, it's really difficult to say, hey, let's go get a drink later. I was playing dodgeball. I was having a good time. And, just one time I went through the ball really extremely hard. I landed on my back, not because someone had hit me or I'd slipped. It's because my knee had just given out and collapsed on me. And I've never had an injury like that before. And so kind of like that was the end of my dodgeball career. But what I thought I'd done is I'd sprained my knee or something, because I had physical therapy centers at the time. I had physical rehab. And so I started doing therapy, and it just wasn't restoring back to where it used to be, if that makes sense. And so it was somewhat better, but I still had a lot of weakness. I had swelling. And different motions, especially lateral motions, would make me feel like it was going to collapse again. So I couldn't stress it. I couldn't run or do any kind of, evasive activities, like dodgeball or any other sport. So I finally said, I need to do something different about this than physical rehab. Went to an orthopedist. Basically, he told me from an MRI that I had torn my ACL, and that I had to get it repaired. And that was the only option I had. Now, I thought when he said repair, my vision of what repair was that they were going to take the tissue and they were going to sew it back together with some, whatever, right? That I thought that's what they meant. And it turns out it wasn't that. They wanted to take out what I had and replace it with part of my hamstring, or even cadaver tissue. Those were my 2 options.
Okay. Right.
And both of them sucked to me. And I was like, first of all, I was like, that's not repair, by the way, that's replacement. There's a huge difference between the two.
Yeah, no, for sure.
And so I just said, these are terrible options. And being in practice for quite a while at that time, I was like, I'm not seeing a lot of people that have been really happy with their knee surgeries. They just never were 100%. They would always have to go back and get a revision or update or whatever. They'd always have something. and I didn't want to go down that path. So I was looking into other alternatives to fix it. I found that they were doing stem cell therapy out of Bangkok, Thailand, and I didn't know if it was real or not. You can read stuff online and go, well, this could be made up. So they were saying all these amazing things that was happening. So I decided to take a trip there. I wanted to find out for myself if it was real, and I did. I went to the clinics, and they were true. The people were getting amazing results, and they were using stem cells from their own body. They were using bone marrow, and they were repurposing those cells, and it was helping people heal. And I thought, this is amazing. I want to do this, but I'm in Thailand, and I don't want to do this kind of a procedure way over across the world, because I was in Atlanta at the time. So I said, you know what, I'll find another solution, this kind of procedure, something I can do here in the States. So when I got back, I actually was contacted by this company that just started selling what's called perinatal tissue. And what that is, perinatal tissue is the tissue after a baby's been born, and then the rest of the, umbilical cord and the placenta and all that other stuff, that's called perinatal tissue. And they were recycling these cells, these stem cells in it, and they were basically concentrating it, and then you could use it for a therapy. And so I was like, well, if this works for me, I mean, I'm going to be a huge fan. I'll be your biggest fan, really. And I couldn't believe it. I did a 1-minute injection. Literally, my nurse just injected, and that was it. And 4 weeks later, I felt really good. I was feeling strong. I was feeling healthy. After 6 weeks, I was absolutely back to where I was prior to the injury. I was running. I was able to do all the exercises and everything. And I never had to have surgery. So, a lot of people ask, how long did this one procedure last? And It's been, it's 2013, right? And, or 23, I'm sorry, 2023. So it's been 12, 13 years. And it's still going strong. It's my good knee now. So, so that's what got me involved in this whole thing, was my own experience in regeneration and longevity. So that's where it got started.
Wow. I didn't know that about you. We've had a number of conversations before. So thank you for sharing that to myself and the audience. Let's take a little bit of different tour here from stem cells to more focus on the sleep and maybe the evolution of sleep science. And if you can explain maybe your understanding. I know you've had some issues with insomnia yourself, and maybe let's focus on insomnia of where did we come from, where are we at now, and where are we heading with sleep science?
Well, the reason I kind of one area of focus that has been primarily for the last 6 months to a year is been in sleep. Because look, when you do a stem cell procedure, the first question I get is, what are my chances? What are my odds? Will it work for me? Kind of things like that. And really what determines that is, one primary thing that you have to look at is your recovery. How well are you able to recover? And recovery, as we both know, happens when we sleep. And if you're not sleeping well, I don't care what kind of stem cells or peptides or, you name it, you're just not going to get much better, or not that fast, at least. So sleep is a huge thing that most people kind of just put off, and they think I'm fine with 5 hours of sleep or less. And, I'll go nights where I don't have any sleep. I'll be fine and I can recover, but your body needs that time to recover. And I went through my own major issues with sleep. And so I decided I need to help, because I went through this. The field of sleep science should have been dramatically improved over the years. However, many of the current sleep providers out there use outdated procedures and techniques. I mean, I went through the mill myself. I got to see what was going on, and it's not a good thing. All they would do, their updated thing was just different medications and sedatives and stuff like that. And that's what they mostly still do. and we know that medicine is only a temporary fix, not even necessarily a solution. It doesn't look at the underlying issues. It's like a band-aid for a broken leg. It just doesn't, it's ineffective long term. And sleep is a complex dynamic process, and it is crucial for our health. So today you need to look at modern things that science has shown is effective. Like, look at your genetics, look at hormones, look at psychological influences to help resolve sleep issues. The future of sleep and the science is more in highly personalized treatments, therapies such as peptides and stem cells and exosomes. These are the future of sleep science. It's not just a one size fits all, solution, take this medicine and you're all fixed. It doesn't work like that. You need it to be specifically tailored to you and use the new scientific discoveries that are out there. And I just don't see that now. And I didn't experience that myself.
So I want to underline a couple of things for the audience. So I think number one, first thing, medications probably have their place in some instances, but
they do.
Look at the whole person, the genetics, the epigenetics, the lifestyle, right? I think that's what I heard. You didn't use those words exactly, but I'm a huge proponent of it. That's what I think I heard you saying, is like, we've got to look at the whole person, their lifestyle, number one. And then number two, you brought up peptides, exosomes, stem cells in regards to sleep issues. So I'd love for you to just dig into that a bit more and what you're seeing or what you're even incorporating yourself.
So I found that these, peptides, stem cells, and exosomes are extremely effective when it comes to problems with sleep. It is a kind of a whole new world of science. Peptides are like these little miracle workers that can help balance your sleep hormones so that you can get better sleep. So peptides are awesome in that. Although right now, most of our listeners probably don't know this, but the FDA is really making it difficult for us to actually even use peptides. Like they're basically trying to make it like a Schedule II drug, which makes it very difficult for anyone to get. The pharmaceutical companies are basically, stepping in to try to take over the market.
Yeah, Ross, sorry to interrupt, but that with one of our other speakers in the summit, that briefly came up as well. But we never got into this. And I'd love for you to just maybe really very briefly, just for the audience, what is a peptide? And just explain that to them, and then please continue after.
Yeah, a peptide is an easy way to look at peptides. It's a small protein. So proteins are made out of amino acids, right? And amino acids bond together and they form long chains. Now, when the chain is more than 50 units, then it's called a protein. But if it's less than 50 units, it's called a peptide. Like insulin, for example, is a peptide. And what it does is it is a signaling molecule that signals the body to do something, whether it be it can help with sexual function, it can help with longevity. There are so many different peptides out there that do various things. They're like advanced nutraceuticals, I like to think of them as. So peptides are really, really effective nutraceuticals, supplements, whatever you want to say. And they signal the body to do something, and usually do it better than they could without the peptide. So that's what I would say peptides are. Now,
sorry, Ross, just one more thing. Just with the understand that the lay audience might not be able to get their hands on peptides very easily, or maybe not at all in the near future. Hopefully that is not the case. But what would be one or two, if someone was able to get their hands, what is like one or two peptides that are particularly for sleep or insomnia or whatever that people should look for?
There's two I would give you. A DSIP, it's called Deep Sleep Inducing Peptide. Hey, the name says it all.
Yeah.
So that's one. And then a kind of, I would say, a broad spectrum peptide would be BPC 157, kind of like the go-to peptide for everyone.
That's like that's the only one I've ever used myself, actually, is BPC 157.
Yeah, and that's the most popular one because it does so many great things, and it has very little or very few side effects. So it helps to stimulate tissue regeneration. It can help with gut issues. it has a lot of different benefits that it does, and it has very few side effects. So usually people start with that, but then and then as whatever condition they're suffering from, you can start looking into various peptides that are more specific to that condition. So with sleep, the DSIP is an ideal one to take.
Okay, so we're kind of hit on peptides. What about stem cells and exosomes in regards to sleep issues?
Well, I think those are the most exciting areas to focus on: stem cells and exosomes. Now, I assume most of your viewers or listeners have heard about stem cells, may not know much about them, and they probably haven't heard about exosomes. So let me kind of give you a little bit of information. So stem cells are undifferentiated cells that can become other types of tissue, whether it be bone, ligament, muscle, things like that. So your body is constantly going through a regeneration. If you didn't, you would just basically die. So your stem cells are kind of in charge of that whole rejuvenation thing. Now, when you're using stem cells as a therapy, typically you're either using your own stem cells from your bone marrow or adipose tissue. So it can come from one of those, which does require a minor surgery. Or you can use it from a donated source like perinatal tissue, like I mentioned that I had done with my knee. So both of those are sources of these stem cells. Unfortunately, there's been in the perinatal department, there's been a lot of challenges with the cells not being alive and, if they're real or good or not. So it's a very slippery slope when it comes to doing stem cells. But basically what stem cells can do as a therapy, they stimulate regeneration. So our bodies is going through this regenerative process. If you use stem cells, they can accelerate your regenerative capacity and ability. So if you have damage in your body, which we all technically will have, it'll accelerate the healing of that. But the second thing it does is it takes down inflammation. Inflammation is really the heart of pretty much any health problem, including insomnia. So when you have inflammation, it can affect your circadian rhythm, which is really the most important rhythm of your body. It's the 24-hour cycle when you wake up, when you go to sleep, when you eat. That's all run by your circadian rhythm. And when you're inflamed, that circadian rhythm can get off, and then it can really affect your ability to fall asleep, go to sleep, things like that, or when you wake up. So the whole idea when you're using stem cells to help with sleep is to reduce the chronic inflammation that a lot of people are experiencing or having. And once you do that, the body can function in a more rhythmic way, and it can help eliminate that. Now, recently, they found that so the use of stem cells, say from perinatal tissue, has been kind of controversial because of some problems like rejection. Now, if you use cells from someone else, your body's going to recognize them as foreign cells,
Sure.
and they're going to attack them and kill it. The other thing is that we don't know, there could be other little components in these cells that we don't want. Maybe some of them contain the vaccine, and some people are opposed to having that put in their body and things like that. So what was brilliant,
potentially genetic disorders as well, like maybe
absolutely
sickle cell or something, just as an example.
Yes, because if a cell has DNA in it, you have somebody else's DNA put in your body. We don't really know exactly what could happen because of that. There hasn't been long enough studies to really go, okay, that's not a good thing to put somebody else, millions of other cells of someone else in your body with their DNA. We just don't know what could happen from that. So it's not that it's not still therapeutic. It can be, they are very therapeutic. It's just there could be complications when you're doing live cells. So what was really cool was what they were looking at is how these cells, how does a stem cell function? What actually is the process that occurs in the body? And they recognized, they saw these little tiny bubbles coming out of them, and they thought that was waste from the cell, but it turns out that is the signaling from the stem cell to communicate to the other cells on what to do. So you've got a stem cell, Hopefully you can see my hands.
Yep.
And you've got a recipient cell that is supposed to do the work. So it sends these tiny little signals like instructions. Think of it like instructions. And these instructions are encapsulated. So because they're going through the body and otherwise they'll be destroyed. So these little capsules with instructions go to the other cells. The cells read the information and say, okay, here's the protein we need to make. So all your cells are basically protein factories. They're creating proteins constantly. So they get the instructions from the stem cell. It says to make this, and it makes it. You know, you're a lot of people are more familiar with, say, a vaccine, for example. You know, the mRNA vaccine. What was that? That was basically man-made exosomes, which is the little container with customized mRNA that made the body create a protein called a spike protein to help stimulate your immune system. That's basically the science. Now, I'm not saying whether or not this is a good thing or a bad thing. I'm just explaining the science behind it. Right. So what they found with just the stem cells is they could take stem cells, a concentration of it, and they could capture these little signals, these little messages, these recipes that are being produced by the stem cells, concentrate them and use those. And guess what? They still have the same therapeutic response without the side effects of having a live cell with DNA and other issues that you can potentially have with.
And those are the exosomes, just to be clear.
Correct. It's the exosome. So I myself prefer using exosomes than a live cell from some random person. And what they found is really you get the same response, is the same therapeutic response. So it's just a safer alternative and much more effective, I think.
Right. Very cool. Very cool. Some great stuff here you're sharing with us. So maybe going back to sort of sleep and the restoration, and I think you got to take an all look. Maybe there's that genetic component you mentioned earlier. There's like kind of the physical health, the mental health. How do some of these treatments sort of fall into all these pillars working together, or how's your approach, I guess?
Well, there are a lot of areas that I look at, but I like to But if I look, if I just say, hey, there's 10 things, it's just like way overwhelming. So I like to look at the three primaries. I want to know your blueprint, your genetics. Your genetics can tell us a whole lot about why you are the way you are. So back 20 years ago, they started doing these genetic tests. You may have heard of them, 23andMe, right? Ancestry, right? These were the start of this called genetic testing. But unfortunately, the testing really doesn't tell you much that was very helpful. And it sure didn't give you much in the way of actionable steps you can take. So you would learn, oh, I'm 24% Irish, I'm 54% German, or whatever. You would find, and that would be interesting for maybe about 10 seconds, and then you were done with it, and then that was it, right? So it wasn't really but it was the start. But nowadays, there are some advanced tests out there that can tell you so much more detail about who you are, why you are the way you are. It can talk about your mood, your diet, what kind of diet's right for you, whether you're prone for heart disease or cancer. It can look at your circadian rhythm, your sleep. All these things can be looked at by your genetics. So why not find that out? I mean, it's just one time you have to take this test, and you can look at really why I'm the way I am. So we all have variants. We all have issues that are deficiencies in our body that it's good to know. If I know that I have a problem with XYZ and this can help it, let's say a supplement can help with that, then I take that because my genetics are telling me to do that, right? So I think it's critical that you look at your genetic structure and really address and see what is going on and why you are the way you are. And so that's the first pillar, I would say. The next one is biochemical. I do presentations every 2 weeks at a big institute called Hippocrates Health Institute here in West Palm Beach, Florida. Wonderful place. If you ever are in that mood to become a raw vegan for 3 weeks, they have got a wonderful program. It's a bit much for some people, but it's pretty amazing. But one of the things you want to look at is your biochemistry. And when I do presentations, I'll ask how many of you in the last, I don't know, 6 months have had their blood evaluated to see your hormone levels, look at your any deficiencies in nutrition, and I'll get maybe 1 out of 10% of the audience, if they're lucky, that raise their hand. So we have got all these dials in our body of what's going on, and we refuse to look at them. We're just like, oh, I'm fine. I feel okay. Screw it. I'm not going to look at what's going on inside. We can look at your blood and know so much more about you. So you take your genetics and go, all right, this is how I'm genetically programmed. Now we can look at epigenetics, your expression of your health, but based on your biomarkers. Look at your hormone levels. Hormone levels are so critical. You got to know if your testosterone is high or low. And the other thing about that is also use someone that knows about, like, more specifics. A traditional doctor will look at a blood test and go, okay, you're normal or abnormal. That's it. And that they're missing something critical, your optimum level. Where is your optimum level? You don't want to just be normal. You don't want, because if you're normal, let's say you're a guy and you're in your 50s like me, and my normal could be, say, 350 units, right, of testosterone. So, but where I want to be, my optimum level is, say, 700, 800. There's a big difference between those two. And also the way it makes you feel. Huge difference. Do you want to feel like a typical 50-year-old, or do you want to feel more like when you did when you were in your early 30s? I want to feel like that all the time. So,
and Russ, I like to say, I'm sure you're going to agree that, these lab values are based on, the average, the normal. Well, I'm sorry,
and that's
the average
range.
and the normal people are sick. You don't want to be average and normal. And hopefully everyone who's watching this summit, doesn't want that for themselves. So,
well, what I found when I really got into this is when they were looking at normals, what happens is, as a provider, they don't even look at them. Once it says normal, the only things they're looking for is abnormal, right? But you could be in the low range and still have problems that they're not going to address, because they're only looking at, oh, here's the one that you're severely low in. Okay, great. So you address that, but you still have to address these normal that are not at a good level anyway. So you want to be at this optimum level. And that's the goal. You need to find someone that can find out what your optimum levels are for your age and your sex, and find out what's right for you so that you can feel awesome. I don't want to feel broken down and crappy, right? I want to feel awesome all the time. Yeah, so those are your biomarkers. You have to look at those things. And if you're not, you're doing yourself a disservice. You need to know what's going on there. So that's the second pillar. And the third one is obviously the mental component. We are stressed beyond our brain's ability to handle it. And most of us don't look at that, and they just keep pushing you keep pushing yourself, and your stress goes up. And if you do not take control of your mindset, your mental state, you're in trouble. You're in trouble. If you don't you have to focus on your, getting your mind clear and calm, and allow it to function, because it's running your body. So you really have to work on your mindset and your mental state, because those are the 3 pillars that I found that really make a huge difference in people's health and sleep.
Would you categorize sleep in that mental health piece then?
Well, all of these I categorize. All of these help the supports for sleeping.
Okay,
well.
Gotcha.
If your biochemistry's off, then it'll affect your sleep. If your mental state is off, it'll affect your sleep. If your genetics are not addressed properly, it can affect your sleep. So all of these things are really supports to help optimize your sleep.
Got it. So beyond the immediate impacts of like the better sleep, what are some broader impacts on a person's individual health, their well-being, their daily, activities, et cetera, when they overcome their sleep issues, and maybe in particularly insomnia?
Look, overcoming insomnia is a huge deal. I mean, man, when somebody is suffering from insomnia every day and night, or when it turns night out, they now start to develop anxiety because they're scared of what's going to happen this night. What's going to happen when I go to bed tonight? Am I going to fall asleep? I had been through that for many years where I was sleeping terribly or not at all. And I mean, it's not just that night, but it's the next day. When your mood, how you feel, everything is associated to your sleep. And it's hard to work. It's hard to have a family life. It's hard to be yourself. So overcoming that and feeling rested, it's weird that as we get older, we tend to have problems with sleep. But when we were young, most people, not everyone, but most people tended to sleep really well. They didn't have to take supplements. They didn't have to do all this stuff, right? The kids would just lay down and fall asleep, and then they'd wake up the next morning and everything was great. Well, and then something happened in our life where suddenly now it doesn't work. So imagine what it would be like if you were able to sleep like you used to when you were young. That's kind of that's why I work with people. I say, okay, here's where you are now. You're not doing so well. Let's bring you back to a more youthful state where your body is actually functioning like you used to. And when you can restore your sleep, your brain functions better, you're more creative, you're focused, you can make more money, you can work. It helps your relationships. It helps everything. Your physical body is allowed to rejuvenate itself and repair. You're less prone to illness. Your metabolism is better. You've really got a new lease on life. It's really a game changer. So in solving problems with insomnia is critical. And the stats on sleep issues is horrible right now. When I do a presentation, I like to ask the audience here, I would just say it this way. Most people in the last 7 days have had at one night or more where they didn't get good quality sleep, where they either woke up too many times, they woke up too early, or they had trouble going to sleep, or when they woke up the next morning, they still felt really tired. They just didn't give the energy. And that happens most of the time for most of the people I talk to. And that's not okay. That's when your body's rejuvenating itself. And if you're not sleeping, it messes up everything in your life. And approximately the studies say 10% of the US population is suffering with chronic insomnia right now. So, I was one of those 10%. And it's a horrible way of life, and it's awful. And you need to address it. If you're in this boat, you need to look at these things that I'm telling you. These are the new science. This is what is shown to actually work. It's not about taking another drug. It's about solving your health. Your health problem, your sleep problem is due to a health problem. Simple as that. You got to fix your health. That way you can sleep better. But sometimes your sleep problems, well, most of the time, is causing your health problems. So you got this terrible cycle that you need to break.
Right. Yeah.
Yep.
I would imagine, I don't know the stats off the top of my head. Maybe you do.
I do.
You said 10% for insomnia. I would say
10%.
just general, like let's call it all sleep issues.
Sleep problems?
As minors, I'd say it's probably in the 80%.
It is.
Yeah.
Like the one I was mentioning in the last week, how many people have had a problematic night? 80%. Absolutely.
Okay.
Absolutely. Most of your audience is going, yep, that's me. I
know even myself. I was just like, yeah, 2 nights ago I got up an hour before I wanted to, and I just couldn't get back to sleep. So I'm just going to get up and start working then. So that's not ideal. That wasn't my intention. So it happens to me too. And I do a lot of stuff for my sleep. Absolutely.
No, but so, and that happens. And there is, I would say, some normalcy. I mean, it's more common, really. It's common, not normal, meaning a lot of people have it, but it doesn't mean that it's normal. So it's still something that should be addressed. But when it becomes more chronic and it's more frequent and people become more desperate, you got to fix it. You got to fix it. And I was able to figure out what it was to break the insomnia. So, and that's what I teach people now is 30 days. I'll solve your insomnia. That's what I do now.
That's amazing.
And I
So,
use all these advanced techniques that I've been mentioning with the stem cells, exosomes, peptides, blood markers, genetics, epigenetics. We do the whole thing.
very, very cool. Very cool. So, Ross, just as we wrap up here, I'd like to ask this question of you. So let's put sleep aside for a moment, right? Let's
Okay.
put sleep aside. This is the Reverse the Effects of Aging Summit. So maybe let's put even peptides and stem cells and exosomes aside too, because you're already into that stuff. So sleep and all those three aside, what do you do? What's the top thing outside of those that you do to reverse the effects of aging in yourself?
Well, it's a lot of things. It's my daily routine, the things that I do. I think exercise is critical. Got to exercise. I like to run, and that clears my mind. You've got a body movement, supplementation, of course. I mean, I take, I don't know, 50 supplements a day. So, I definitely think, you're not going to get your nutrition from your foods like you used to be able to. So you got to supplement your diet. Light therapy is critical. Get out, get some sunlight in your eyes, produce the vitamin D. I also am a huge fan of saunas, infrared saunas. I try to do them at least 3 times a week. Also cold plunges. I'm a big fan. I love cold plunges. Let me say it the way I love the effect of cold plunges. I
Right,
don't
right.
like
Nobody
getting in.
actually likes it. Nobody likes it
Yeah,
when they're
no,
doing it.
I don't get it. I go in. Every time I go in, the burning pain feeling that you get, I'm just thinking that is all the bad stuff leaving my body. Like, the pain is the weakness leaving the body. That's basically what I'm thinking my whole
Right.
time when I'm in there. And then routines, like in the evening. I have a set routine. I wear the glasses like you have on now. I put an alarm. One of the things I like is set alarms for things that you do for routines. Like I have an alarm that tells me I need to exercise and start running or do my exercises. And then I have a nightly routine where I turn off the computer. I turn all the electricity, the stimulants. I put on my glasses and I do something relaxing, whether that be read or play guitar, which I do. I try, and I'm not good at, by the way, so don't ask me to play. But I think it's all into your routines that really make the biggest difference. Show me your routine and I'll show you your health is really what happens. And then it goes back with what you're eating. You have to have a diet. And I don't talk about whether or not keto or vegan or vegetarian or any of the 50 other diets, which one is the best. What I do when I teach is I say, look, eliminate things, eliminate the sugars, eliminate the processed foods, right? You take these things out of eliminate seed oils. Let's see what else. I have 10 that I normally go through, but I'm kind of blanking out. But
gluten, dairy,
but
maybe depends on the person.
yeah, those aren't as critical, I say, but definitely the sugars, the white flours, the seed oils, the fried foods, the candies, the alcohol. Take away all the bad stuff that causes acidity in your body. And I'm not going to say where you should get your protein. You could get it from meat or you could get it from fish, or you could just get it from vegetables. I'm not the end all be all. And I think it's different for some people. Some people really thrive on a vegetarian diet. Some people are more the meat eater diets. You got to find what's right for
I
you.
think goes back to your epigenetics, right? And you got to, and there's
Your
cultural
genetics as
issues
well.
and ethnicity issues and lifestyle and
Absolutely.
what your goals are.
Look at your genetics as well. You do a genetic test and it can help guide you on some areas that you might want to focus in with your diet.
Yeah. So Ross, you have a program, DocInsomnia.com, and just for the audience, we're going to have all of Ross's, links for socials, where to find him, his website, etc. And you have a sleep program, and you're offering a discount to all the audience members or attendees. Can you just tell us what the program's about, really, really quick?
So, I'd love to. Basically, what I do is I explain all the different. So it's a training program with coaching. So what I found is that when somebody comes to me and they have insomnia, I need to, there's a lot of education on their optimizing their health that they need to know. So I talk about all the different, I have a weekly program that I release. They can watch it and they can take action steps to help with that area, whether it be genetic testing, epigenetic testing, blood testing, or whatever we're going to do. Plus, I just talk about other therapies, all the newer therapies that and how they work and how they function and how they help people. And then I have a weekly coaching that's live where they can come on and ask questions because, with courses, typically, you buy it and, there's
Right,
nothing,
yeah.
there's
You
nothing
need that
there.
you need that accountability of coaching.
Exactly. So I made a Facebook group so that you join that. And and then there's the weekly coaching, which I'll just go on and answer questions and help people along that are confused about something or need help with something or advice, and then I just lead them down that. And also I share with them my story on how I broke the insomnia pattern, because I was in a pattern of insomnia every night, and I talk about how in one night I was able to break that pattern. So that's a good one. And also how to I had to get off of I was addicted to sleep medicine, so I had to learn how to get off of sleep medicine, and I share people with them how to do that as well. So it's really a comprehensive, it's a 12 how many weeks is it? It's 8 weeks. I forgot. It seems like a lot. It's an 8-week program, and at the end of it, they're going to know all about health and longevity and sleep, and I guarantee that they'll get better, or they get their money back. Simple as that.
Amazing. And just by the stats you said, approximately 10% of the attendees here are going to be suffering with insomnia. So definitely check out the program.
Oh, yeah.
Again, the link will be right below this interview. And if you want to, listen to Ross again, enjoy this interview and all the interviews from all our great speakers, to have for a lifetime, don't forget to upgrade to the VIP package, just $97 during the event, and it will be going up afterwards. Also, don't forget to check out our wonderful sponsors who enabled this to be a free event for all of you, companies like STEM Regen and HBOT USA. Ross, I want to thank you again for joining us here on Reverse the Effects of Aging Summit. It's been a pleasure to have you.
Thank you for having me.
Awesome. Everyone, I will see you on to the next interview. This episode is brought to you by Optimizers Magnesium Breakthrough. This is a product I've been using and our family's been using for 4 years already. What I love about it has 7 different forms of magnesium in it, all the forms that your body needs for all 400 processes that your body needs magnesium for. Most magnesium supplements have one form and usually a crummy form of magnesium. This has all 7 forms that your body needs. So click the link and get at least 10% off. Sometimes there's specials and you even get more. So check out Bioptimizer's Magnesium Breakthrough.
Podcast produced by the Minted Green Company